Good evening and greetings. My name is Muhammad Aira, a medical student in Fakultas Kedokteran Universitas Pajajaran. And today I would like to use this opportunity to give a simple and short explanation about sleep disruption and its effects to our brain and our body. But first I would like to address sleep as an overview. Now sleep it is a biologic process that is essential for life and optimal health in all living beings, and that includes us humans. Because sleep plays a critical role in brain function and systemic physiology, including metabolism, appetite regulation, and the functioning of immune, hormonal, and cardiovascular systems. Now, a normal and healthy sleep must fulfill some of these conditions, which are sufficient duration of sleep, good quality, appropriate timing and regularity, and lastly, undisrupted, which means the absence of sleep disturbances and disorders. Now, let's first discuss about sleep disorders. Because just like anything that can go wrong will go wrong, even sleep itself may have disorders. And there are approximately at least 100 sleep disorder classifications. But in the end, all of them can be manifested in one of the following three ways, which are first, sleep deprivations. It means a failure to obtain the necessary amount or of quality of sleep. And next is a disrupted sleep, also called sleep fragmentation. It is an inability to maintain sleep continuity. And lastly, events. What events? They are events that occur during sleep. Examples would be sleep apnea or restless leg syndrome. Now, as for the risk factors of sleep disorder itself, they are so many and fast, and they all involve a combination of many factors. Some of these factors are biologic, psychologic, genetic, or social factors. Let's take some examples. Lifestyle factors. Some of the risk factors would be an individual who may consume an excessive amounts of caffeine, or even drinking alcohol, or worse, drug abuse. And for occupations, examples would be a office worker who have to do some shift works until late at night, or even university students who had to do some assignments until past midnight and thus disrupting their sleep-wake cycle. As for the environmental factors, there are many, and they all come from outside our body. An example would be excessive light or noise when an individual is trying to sleep. As for the psychosocial factors, an example would be stress, anxiety, worry, or rumination. They all revolves around mental health problems. And another example would be a parents of a young child who may awake in the middle of the night and thus disrupting the sleep of the parents. Now, lastly, for the medical conditions factor, it involves some sleep disorders and underlying diseases. As for the sleep disorders, some of the examples are insomnia, obstructive sleep apnea, restless leg syndrome, or even circadian rhythm disorders. And as for the underlying diseases, they may be chronic kidney disease, restrictive lung disease, diabetes, even psychiatric disorders. Now, even the slightest stimuli like pain, it may disrupt our sleeps in the middle of the night. Now, I am about to explain the physiologic changes that sleep disruption has to our bodies. It mainly revolves around the activations of the sympathetic nervous system, the sympathoadrenal system, and the hypothalamic pituitary adrenal axis. And all of these systems leads to some of these changes. First is an increased metabolism, evidenced by an increased oxygen consumption and carbon dioxide production. Also, there have been found an increased levels of catecholamines, norepinephrine and epinephrine, which may be correlated with fragmented sleep. It has also been found some increased secretion of adrenocorticotropic hormone and cortisol, which may be found with patients with chronic persistent insomnia. Suppression of deep sleep itself was associated with decreased insulin sensitivity. However, this decrease in insulin sensitivity did not result in an increase in insulin release. And thus, sleep disruption itself may be correlated in increased risk of type 2 diabetes mellitus. Another changes would be an increased appetite due to increased ghrelin and decreased leptin secretion. Sleep abnormalities itself may affect immune function. It happens via changes in pro-inflammatory cytokines such as tumor necrosis factor, interleukins 1 and 6, and C-reactive protein. Now that we know the physiologic changes, there are many consequences of sleep disruption, which may be divided into two, short-term and long-term. As for the short-term health consequences of sleep disruption, first, there are an increased risk and an increased stress responsivity. Now, fragmented sleep, as we know, it may lead to an activation of sympathoadrenal, and thus leads into a production of a combination of transient hemodynamic, vasoconstrictive, and prothrombic processes, and they are associated with a stress response, and thus ultimately it leads to an increased autonomic sympathetic activation. Next is somatic problems. A study has been done in Finnish, and it found that sleep problems are strongly associated with weekly headache and abdominal pain, especially with those individuals which who has at least 6 months of sleep problems. And as for the psychosocial issues, using the World Health Organization's quality of life brief, it is found that sleep disturbance was significantly associated with reduced health-related quality of life. Some of the evidences showed that disrupted sleep may be a major causal factor in the development of depression and anxiety symptoms. Another experimental study showed that partial sleep loss from sleep continuity disruption was more harmful to positive mood than partial sleep loss from delaying bedtime. Furthermore, it is found sleep disruption also alters cognition and performance in many domains, such as attention or vigilance, executive function, emotional reactivity, memory formation, decision making, risk taking behavior, judgment, and even less precise motor control. Now, numerous studies in adolescents found that sleep disruption also had a negative effect on, first, psychosocial health, evidenced by the onset of poor mental health status, loneliness, worry, anxiety, and depression. Sleep disruption also have a negative effect on school performance, as found in a study that shows students with excellent performance had earlier bedtimes and longer sleep on weekdays with less severe daytime sleepiness than those with poor performances. Sleep disruption also had a negative effect on risk-taking behavior, particularly in the use of nicotine and marijuana among adolescents. Now, the next is the long-term health consequences of sleep disruption. Let's first take it to the cardiovascular system. As I mentioned before, an increased activity of the sympathetic nervous system due to sleep disruption shows that adults who experience sleep disruption had elevated blood pressure and thus leads to an increased risk of developing hypertension. In adolescents too, higher sleep disturbance scores were also associated with higher cholesterol and higher body mass index. Next, in a metabolic system, sleep loss appears to affect energy metabolism primarily by impairing insulin sensitivity and increasing food intake, and thus it is associated with weight gain and other weight-related issues in both adults and adolescents. Sleep fragmentation also found to alter glucose homeostasis, mainly by reducing insulin sensitivity, reducing glucose tolerance, and increasing cortisol levels, all of them found in populations of higher risk for type 2 diabetes mellitus. So in short, the coexistence of obesity, elevated blood pressure, increased glucose levels, and low levels of high-density lipoprotein cholesterol. It all defines the metabolic syndrome caused by sleep disruption, which manifests in both the brain and the peripheral organs. And lastly, cancer. Sleep deprivation have also been shown to accelerate tumor formation and may increase the risk of cancer through the disruption of circadian rhythm. An important hormone in circadian rhythm, melatonin. It has some important properties, including DNA repair, inhibition of tumor growth, and it may also act as a potent free radical scavenger. Now, an exposure to light at night decreases the production of said melatonin, which may lead to increased production of reproductive hormones. But in the end, the mechanisms by which sleep disruption may cause carcinogenesis are still not clear. Much of the work is still focused on nighttime light exposure and decreased melatonin levels. And with that, I conclude my brief explanation on sleep disruptions and its effect on our body. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.